Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, everybody? This is Christian Brindle. Welcome back to the Everything Medicare Podcast, the number one Medicare-based podcast in the country since 2018, okay? Thank you all for being here with me today. We are going to talk about the Medicare Part-B premium increases. They've been announced courtesy of about a week ago. I'm recording this about October 17th, 2023. We're going to talk about what this premium increase means, what my reaction to it is, the Medicare Part B premium, and everything else in between. So let's just kind of jump in. So, Medicare Part B premium. The Medicare Part B premium in 2023, for those of you that may not be aware, is $164.90 a month currently at the time of recording this. Now, if you're not familiar with what the Medicare Part B premium is, Medicare has two parts that come from the government. Everything else you ever hear about comes from a private insurance company, okay? And so Medicare Part A and B are the two parts of Medicare that come from the government. They're kind of looked at as your foundation of your Medicare. They fit together to give you medical coverage. They both cover different areas. And Medicare Part A is paid for through FICA taxes over the course of your working life. Social Security, Medicare throughout your working life, those taxes are taken out to pay for your Medicare Part A premium. So your Medicare Part A premium is paid for and sufficiently paid for, I should say, as long as you've worked in the United States at least 10 years of your life, or 40 quarters. Now, Medicare Part B is not paid for by FICA taxes. Medicare Part B has a month-to-month premium that everybody on Medicare pays, with the exception of people that are on Medicaid. If you're on Medicaid and you're in low-income brackets, if you're not familiar with what Medicaid is through your state, then Medicaid or Medi-Cal, if you live in California, can pay some of those month-to-month premiums for you on your behalf. Outside of that, everybody pays the Medicare Part B premium. Now, the Medicare Part B premium is going from $164.90 in 2023 to, drumroll please, $174.70 a month in 2024. Now, there is a little bit over a 3% Social Security cost of living increase scheduled to take effect in January as well. So that should essentially take care of that, but it will eat into the cost of living bump that seniors are getting on their Social Security in 2024. Now, is this a reasonable increase? Well, it's slightly less than about $10 a month increase. It's 20 cents less of being a $10 monthly increase. Now, if you remember, if you've been on Medicare long enough, the Medicare Part B premium, and for those of you that don't think you might be paying the Medicare Part B premium, if you indeed are on actual Medicare, Medicare Part A, Medicare Part B, my office talks to people every single day that don't realize they're paying the Medicare Part B premium. For most people, it's coming out of their Social Security check, 1 month at a time, and it's not shown on many statements. It's kind of out of sight, out of mind of sorts. So if you've been on Medicare long enough and you recall, 2021 to 2022, they had the single biggest Medicare Part B premium increase that they've had in over 30 years. The Medicare Part B premium went from $148 and some change up to about $170. That was a huge jump. That was a $22, give or take, dollar per month jump in the Medicare Part B premium. They lowered it from $170 and some change down to $164.90 from 2022 to 2023. To kind of soften the storm, weather the storm, if you will, from the outrage that was had from the 2021 to 2022 increase, okay? So I was kind of expecting it. Now, in years past, we've seen, $1, $2, $3, $4, $5 a month increases. We've seen $10 a month increases. It's not outside of the realm of normalcy, is what I would say. the Medicare Part-B premium for anybody that's on a Medicare supplement plan. The Medicare Part-B deductible for anybody that's on a Medicare supplement plan. If you have a Plan G, if you have a Plan N, this does impact you. The Medicare Part-B deductible on those plans is something that typically you are responsible for a various amount of things, and the Plan Gs and the Plan Ns and the Medicare supplement plans don't cover those. For Plan G, for example, it's the only out-of-pocket responsibility you have as a person on Medicare, as long as it's a Medicare-approved charge and it's a medical service, okay? In 2023, the Medicare Part-B deductible was $226, a decrease from the previous year of 2022, where it was $233. So in 2023, it was a $226 one-time-a-year deductible. Next year, it's going from $226 to $240. Kind of expected. Anytime you have the premium decrease from the previous year, you can expect it to go up, and same goes for the deductible in 2024. Okay? Now, what are my thoughts on this? I believe it's normal. I think it could have been a lot worse. I think we're seeing the ever-growing costs of healthcare. I think we're seeing the ever-growing costs of just everything due to inflation and just how the economy is right now. So I think it could have been a lot worse than we anticipated. Also, for those of you that don't know, Medicare has a projected premium increase that they put out, the Centers for Medicare and Medicaid Services, usually in September, early October, and then they put out the real numbers mid-October to early November, depending on the time frame in the actual year. And the projections that they put out were pretty in line with what we are seeing here. They're pretty close. So usually you can kind of get a good idea if you look at the projections. They might not be exact. They might not be down to the penny. However, they are going to be fairly accurate in most cases. But there you have it. You have $174.70 a month Medicare Part B premium for 2024 and a $240 Medicare Part B deductible for 2024. Now, if you're on a Medicare Advantage plan, the Medicare Part B deductible does not apply to you because you have a Medicare Advantage plan. Your Medicare is being ran through a private insurance company, and they're taking on the risk. They're taking on all of your claims. That's only if you're on original Medicare, okay? So if you're on original Medicare, you have a Plan G, a Plan N, like a Medicare supplement. This does impact you. This is what you need to be aware of. But if you have a Medicare Advantage plan, the Medicare Part B premium increase is not something that you're technically responsible for because you have co-pays on the Medicare Advantage plan. So just keep that in mind. As always, folks, we want to bring you information as it becomes available to us. And we'll continue to do that on the Everything Medicare podcast. If you want to work with my organization, we work with people in over 40 states now. Over 40 states. Christian Brindle Insurance Services. We are, in my opinion, one of the best experiences you can have with your Medicare. And we work with a multitude of different insurance companies. We can help you out on your Medicare selection. We can kind of compare what you have, compare and contrast, make sure that's going to be the best thing for you for 2024. No cost, no obligation. We'd love to be able to kind of work with you on your plan. Our office number is 801-255. Again, 5340. Again, 801-255-5340. Christian Brindle Insurance Services. We'd love to be able to work with you. Give us a call if you need help this open season. We are in the heat of it right now on October 17th at the time of recording this. You have until December 7th to make changes on your Medicare Part D prescription drug plans as well as your Medicare Advantage plans if for some reason you feel like you want to make a change going into the new year. Hope this message finds you doing well. Hope to bring you more educational and updates, educational information and more updates as we go. And thanks so much for being the greatest audience that we can possibly have. We'll bring you more episodes of the Everything Medicare podcast as we go, and hope this message finds everybody doing well. Thanks for tuning in, folks, and we will see you next time. Here's to a prosperous holiday season. Thanks all.